Hello. Very good afternoon. Am I audible to you? Hello.
Yes, sir.
Yeah.
Yes, sir.
Uh,
Yes, sir.
uh, from KL College of Pharmacy in association with IPA local branch Belagavi, we are conducting a series of guest lectures. In that, today's guest lecture is to create awareness regarding the insulin. So, hence we kept the topic as an effective and safe use of insulin preparations. So, I think hopefully a few of you might be knowing my colleague Ramesh Bhandari. Before start of the session, I would like to welcome you all for today's webinar. And our Vice Principal Sir has been also been joined. Wholeheartedly welcome Vice Principal Sir to today's webinars. And before start of the session, I would little bit brief introduction regarding one of my colleague, Mr. Ramesh Bhandari. Sir is having a 2.5 years experience in our college as an assistant professor. Sir is having 13 publications, including national and internationals to his credit. Sir has received a second prize in the first national PharmD colloquium in best oral presentation, and sir has received best oral presentation from ISPOR, and sir is presently serving for the various international and national journals as a reviewer, and recently sir has received APTI ICT Educator Award. With this little introduction regarding sir, we can continue with the today's session with the topic effective and safe use of insulin preparation. I request Ramesh sir to continue with the today's session.
Thank you, sir, for your short introduction. A very good afternoon to all the participants and warm welcome to this webinar on effective and safe use of insulin preparation organized by Kelly College of Pharmacy, Belgavi and IPA local branch, Belgavi. So first, let me share my screen, then we'll start with the session. Okay, can anyone confirm that you are able to see my screen?
Yes, sir.
Yes, sir. Visible.
Yes, sir.
Okay, thank you. So first of all, I would like to make it clear that this presentation is a part of extramural research activity, which is intended for elderly people, because title itself is suggesting it is for elderly populations which will be using insulin preparations. So it is mostly intended for elderly people in the community setup, but unfortunately due to this COVID pandemic, it is not possible to gather elderly people in one place. So we decided to provide this information to the students, believing that they will disseminate this information to their parents, neighbors, and the needy ones. Since you all are pharmacy students, I have added one case study related to the insulin error so that it will make grip on the topic. Okay, so first of all, we'll walk you through the case study. Hence, we'll start the session. So this case is related to the hyperkalemia. So one patient admitted in the emergency department with hyperkalemia. So in hyperkalemia, the patient has been prescribed with 10 ml of 10% calcium gluconate, 50 ml glucose of 50%, and 10 units of atrapid insulin. So this is the standard treatment for hyperkalemia cases. But during that time, the intern nurse was working in that hospital. So due to that intern nurse, one error has been occurred due to this prescription. So the intern administered an infusion of glucose containing 100 units of insulin instead of 10 units. So approximately 3 hours later, another nurse found that patient unresponsive, and his extremities were cold and clammy to touch. So blood glucose level was found to be 0.7 mmol per liter on measurement. So later the physician has been called, and then the case selection or the patient is condition was reversed with 100 ml of glucose of 50% and followed by 10% glucose infusion. So this case study was nothing but one case scenario which we have seen in our case study, and this is taken from guideline from Irish Hospital. So now why we are taking this case study here is nothing but here we are finding one error. So that error, how it has occurred, there are mainly three factors that the error has occurred in this patient. So first is unawareness of the intern. That means maybe that intern was unaware of using insulin graded syringe. Instead of that, he might have used the tuberculin syringe, which is graded in milliliter. So insulin is usually measured in units rather than giving in milliliter. Hence, the intern mistakenly given the insulin in tuberculin injection. Hence, the patient is having hypoglycemic attack. So next is due to manufacturing defect. So before, this was the case between 2010 and 11. So during that time, insulin preparation, that is Atrapid insulin preparation, was used to come in one vial. So that vial will be consisting of 10 ml of insulin. So in that 10 ml of insulin, they won't write the total concentration of the insulin. Instead, they used to write like rate of that insulin. That means like 100 units per ml. So the intern have misunderstood or misinterpreted that information. He has thought that total vial contains 100 ml, so he might have given more units. So for that reason, later after this case, the manufacturing or the manufacturer has included one thing in that labeling, so that all should include as well as units per ml, but also the total number of units of insulin also should be included in that label. So next, third one is there is no double check, because the intern is prescribing, or you can say intern is administering the drug, so that drug should be double checked. If that double check will be there, means this error can be avoided at that period of time. But due to no double check, the error has occurred. So main theme of this case study is here, that irrespective of the profession, either that error has been done by the intern, but irrespective of the profession, the error can be occurred if we use any medicines, not only this insulin. If we will use any medicines with inappropriately, we can have an error. So for that, first of all, we'll start with our introduction part. So before going into the introduction, first of all, I will say that this presentation is intended as a best practice guideline, and it should not be considered as a document offering definitive legal advice in relation to the effective and safe use of insulin preparations. So with this, we'll start with the introduction. So insulin therapy, as we know, this insulin we'll use mainly for the diabetes. Many of us know also we'll use this insulin therapy in, especially mostly in type 1 diabetes and sometimes in type 2 diabetes. But apart from diabetes, we'll sometimes use, as we've seen in the cases like hyperkalemia conditions, to reduce the potassium level. So like that, in insulin therapy can be life-saving in those conditions, like in type 1 diabetes mellitus, hyperkalemia conditions, and type 2 diabetes mellitus, like ketoacidosis patient, it will be life-saving. But if we'll use same insulin inappropriately, it will be life-threatening for that patient, like we've seen in above case. So according to the Medicare patient safety monitoring system, usually they have performed one study, which I have given reference on below. So 40% of 8,88,000 identified adverse drug events are related to the insulin or other diabetic agents. And next is among 1 lakh reviewed emergency hospitalization patient, they have found 25% of the patient is having error with the insulin therapy. So this shows that insulin, obviously insulin is life-saving drug, but if we will use inappropriately, it will cause an error. So for that reason, insulin is also considered top 5 high alert medications by the Institute for Safe Medication Practices. So this high alert medications means the drug will be having large safety margin, but if we will use inappropriately, those drugs will be causing significant patient harm. So those drugs will call it as high alert medications. So due to these reason only, today we are doing, or we are conducting this effective and safe use of insulin preparations. So in this insulin preparations, mainly we will found n numbers of drugs will be there. So shortly we'll see what are the classes of insulin preparations. So usually based on onset of actions and based on duration of action, the insulin preparations are categorized into this category. So first one is rapid acting, which will be having short duration of action, but it will onset of action will be soon. So next is short acting, next is intermediate acting and long acting. So without describing much in detail with words, we'll depict in here figure. So here you can see we have given in x-axis time in hours, y-axis is nothing but effect of insulin. So here you can see how each category or each preparations of the insulin will act. So rapid acting is acting for longer period as you seen here. So next is short acting. Short acting is little more period it will exist, but the onset of action will be little bit later. So same like regular acting. So most of the time, whatever the insulin we are using, that is regular acting insulin, which will be using for normal or which will be using for usual patients, what we'll see in the hospital setup. But if we want to use it for long acting, like if we want to give it for 24-hour durations, that patient is not able to get frequently the insulin, that time we can give long acting insulin. So this is how this picture or this graph shows how the different insulin preparations will act. So based on that, any one selection or one preparation can be selected. So next is, if we are seeing or if you are looking safe and effective use of insulin preparation, first of all we should have knowledge or we should know that what do we mean by safe and effective use. So safe and effective use nothing but in farm, as we all are pharmacists, so we are aware of that safe is nothing but we should avoid use in contraindications. Like if any contraindications is there in the patient, that time we should not use insulin. So if we are using insulin at that time, we'll call it as unsafe use of insulin. So same like if any precaution has to be taken while giving insulin, any preparations, so that time we should observe those patients carefully. So if we are observing those patients where we should be careful before giving this insulin preparation, that will be the safe use. But if we are not observing the patient, that again will be under unsafe category. So next is prevention of medication error. So safe use is nothing but if we are preventing any medication error, either it is related to any preparation of the insulin, that will be calling it as unsafe. So if we are preventing, then it is safe use. Same like that, if it is we are controlling the patient blood glucose in optimum level, that is achievement of glycemic control with low incidence of hypoglycemia. As we know, insulin will be having hypoglycemia, but as far as possible we should make it low incidence. That means the occurrence of hypoglycemia should be low in the patients, and the severe hyperglycemia also should be low. So then only we can say whatever the insulin preparation we are using, that we are using in effective way. So this is how we'll call it as we are using any insulin preparation in safe as well as effective. Okay, so here are some strategies that will define how we can improve or how we can improve safe and effectiveness of insulin preparation. So first of all, we should provide suggested procedure for the initiation of insulin. So next is we can ensure that the patient is able to take insulin injection independently as well as safely and effectively. So next is we should provide education as well as support for the patient, and wherever possible, like most of the insulin preparation were taken by elderly patient, so sometimes they will be having forgetfulness. So for that reason, in that scenario, we should provide information on the on their family as well as provider and staff members wherever possible. And last one is we should promote an empowering education program like this what we are conducting. We should conduct it for the elderly population who are using the insulin therapy. So if we'll you promote or will give or will empower these kind of education program, which will help them to control the blood sugar level or to control the diabetes disease in their case. So next is, first we'll start with the education. So education in the sense, first of all, we should give some education to those patients why they are taking those drugs. That means if patient is taking insulin, what is the role of the drug? but because until and unless people are not aware what side effect or what adverse effect the patient will suffer if insulin is not given in safe or an appropriate way, that thing should be educated to those patients, or we should aware them in those matters like what is the need for this insulin treatment and when we should not use this insulin treatment, that is contraindication part, as well as we should say them complications. Even though we'll use like insulin injection, what are the complication or common complication that patient may have. So if we'll give these kind of information or education in prior giving this insulin, that will prevent medication error as well as any other complications which will occur due to inappropriate insulin use. So next is education on the use of the equipment use. So this means, as we know, insulin is not only available in the vial form, it is also available in some other preparations like cartridges, vials, and sometimes pens. So whatever the equipment they are using, some patients will be based on their convenience, they may use injection or they may use pens or sometimes they may use cartridges. So in that scenario, you should educate them about that equipment, how that equipment can be used, and like if patient is using pen means how that pen they should use, or sometimes they are taking subcutaneous injections, that time they should be able to demonstrate that how that subcutaneous injection of insulin can be administered. So next is, as we said before, insulin and their actions. You should make aware them why they are taking insulin as well as what is the main actions of their insulins. So those things you should take, you should educate them prior giving this insulin therapy. So next is, whenever you are giving or you are educating them to administer the insulin themselves, so that time you should discuss the process from starting to the end. That means how they should initiate their insulin injection, like if they are having any insulin injection or pens or any other preparations, how they should start. You should discuss with those process with those patient itself first. Otherwise if patient is not able to listen, or you can say sometimes the patient may not be able to get those all detailed description process, so that time you can say to call the family members if possible. So if family members of the patient is there means family care representative, that patient can or that person can take care of that process for injecting the insulin. And finally, that reassure, we should reassure either patient. Most of the time patient will be having fear that if we are taking injection by ourselves that we may get infections, or if we'll get injection by ourselves sometimes it may go in wrong side, so that will again cause some side effect or the adverse events. So that time you should reassure the patient, that patient, if a patient is having any fear and all, you should reassure the patient by asking some questions. Okay, so now at giving educations also, whenever possible, the patient you should ask either they can perform the blood glucose reading or not. Sometimes what will happen, we'll say all the procedure in detail and patient will follow it. But during that period of time, sometimes the insulin dose may be less or sometimes the insulin dose may be more. So for to avoid those kind of error, what we'll suggest the patient to keep one glucometer with them, so that glucometer will help them to see or to observe the blood glucose level whenever they are taking the drugs, or whenever they feel that if they are having hypoglycemic attack or hyperglycemic attack, so that time they will be able to perform blood glucose reading. So next is, we should demonstrate to the patient about use of the device what they are using and which will appropriately deliver the insulin preparations. And third, last one is nothing but demonstrate to the patient that the correct technique for subcutaneous injection. If patient is taking any subcutaneous injection, we should first demonstrate how subcutaneous injection can be given. So if we'll demonstrate these all the things, later we should discuss, like if patient is having or patient is taking themselves as these injections, we should say them first where that is nothing but the sites of the injection where they can give those subcutaneous injection. So here I have made one figure where you can see from where the patient can take subcutaneous injection, that is back of the arm, These are nothing but back of the arm. Abdomen, they can inject the subcutaneous injection of insulin, and the outer thigh, this is nothing but thigh region. In thigh region also, outer thigh, they can inject the insulin. So these are nothing but different sites. So here one more thing we need to understand, that injection rotation. So injection rotation means, like patient is taking, if say for example patient is taking one subcutaneous injection of insulin in abdomen one time, means we should not change the site. Like if we are giving in one injection here, tomorrow we should give thigh. It is not good practice that we should change the sites frequently. So instead of that, what we can do, if we are giving in abdomen region only, one injection if you are giving in one direction, so next time, next injection, you should change the location on the same sites. So same site in the sense, say for example, if we have given one injection in this site in first day, so next day in same region, you should clockwise, you should rotate your injection site. Like here you can give next day, so third day you can give here, fourth day you can give here. So like in that scenario, you should rotate your injection site in the same site, so that it will follow, it will avoid the lipohypertrophy of that site, as well as the insulin will be absorbed consistently. So if we'll give one injection today here, another tomorrow's if we'll give here, means because abdomen sites will be having different absorption capacity than this thigh muscles, so that will again deviate your effect, or that will again occur some error if you will do changes in the injection site. So one side you should rotate inject. Okay, so now you may be having doubt that okay, we are changing the sides, but some people will take here in the thigh region, or some people will take in abdomen region, and some people will take in the back of the arm region. So that selection of these kinds of sites will depend on the absorption capacity of those sites. So how we can select the site of the insulin? First is nothing but the abdomen. So here we have to give injection in the abdomen region only when we want fast. So if we want faster actions of the insulin, we should give it in the abdomen. So best example for this is if patient is having postprandial blood glucose level more. So postprandial means after eating the food, if patient blood glucose level will rise more, that time if we want to reduce that blood glucose level, it is better to give in the abdomen region, because from abdomen region this insulin will be absorbed faster. So next is from the arms, that is back of the arms, you can, it will be slower than thigh or outer thigh region, it will be even slower than the arms, and the slowest from the buttocks or hip region. So this insulin site selections will be based on the patient condition. Like if patient is having PPBS, postprandial blood sugar level more, then we should suggest him to give in abdomen region. Otherwise patient is having little bit, or you can say borderline hyperglycemic, that time you can give in even thigh region also, or even in the back of the arms region also. Okay, so these things you should describe to the patient itself. So why the patient has to take from abdomen region, why the patient has to take from arm regions, thigh or the hips region. So next is you should also make aware, not only regarding the insulin therapy, you should also give education on meals as well as insulin injections. So that means not only the insulin injection is important for the diabetes patient, but also the eating habits, what they will eat and how they will eat. So those eating also are important, so that also you should make emphasize, or you should strain on those. So next is the patient information leaflet. As we know, the elderly populations are having forgetfulness. So to avoid that, what we can give all the information what we have described till now in a patient information leaflet. So in this patient information leaflet, we can give all the details what we have described till now, plus we can give hyperglycemia. In case of hyperglycemia, what to do. In case of hypoglycemia, like we said before, patient is having cold as well as unresponsive, so that time what to do. So those all kind of details we can give in patient information leaflet, which should be written in their language. Okay, so next is patient re-administered. That means whenever you have demonstrated or how the insulin injection has been taken, so those things you need to ask to the patient, either they can re-demonstrate the same procedure what you told to that patient, because if they are not able to demonstrate, you can repeat it as many times as needed. That means until and unless patient should be able to demonstrate the insulin injections how you told them, or you can say how you suggested them to take. So like in that way, if patients are able to demonstrate, so along with that, storage and handling of insulin. So one thing, by storage and handling of insulin also will be causing some medication error. So to avoid that, you can suggest the patient. So one main myth will be there in all elderly populations, or you can say most of the patient, that we should keep our insulin preparation in the fridge itself. Obviously, I'm not saying that we should not keep in fridge, but we should keep in the fridge. But once we'll start, or you can say once we'll open our vial of the insulin, so that insulin itself, it should be kept in normal room temperature. If you will keep that in under normal temperature also, that is 59 to 86 degree Fahrenheit, or in Celsius, if we'll say 23 to 25 degree Celsius, if you will keep, that will be as it is for 1 month. It won't spoil for 1 month if we'll keep under room temperature once the vial is opened. So if you are not opening the vial, or if you are not using, then you can say you can keep the insulin vial or any other preparation of the insulin until and unless the expiration date will be there. So that means in expiration date is there till December, then till December you can keep in fridge, but after December you should not use those preparations, because until, if you will keep in fridge also, you should not use those kind of preparation which are having, or which are having expiration date of. Okay, so next is opened bottles which are stored in the refrigerator should be used within 1 month of being opened. Whichever the preparation, it will again depend on the preparation. I'm talking more about the vial. So in vial, if you are opening in one today, so it should be used within 1 month of opening of that vial. But in some cases like pens, if we are using, that pens will be mostly used for few months or few 10 days to 1 month. So it will be based on again insulin preparation, but no insulin preparation should be used beyond 1 month. Okay, so insulin storage, once we said before, if insulin preparation has expired, or you can say past the expiration date, that time you should not use those kind of insulin or those types of insulin. And no matter what, if expiration date is passed, so that time you should discard the vial in 1 month. So next is always, if we should keep the insulin in the fridge, but the insulin should not be freeze or frozen. So if insulin is frozen, we should discard that insulin, and we should not allow or encourage the patient to use those types of insulin. So next is, we should obviously, if we are saying that we should keep in room temperature, we should avoid from direct heat and sunlight. And one main important thing is, whenever if the patient is taking, or if the patient is keeping their insulin in the refrigerator, it is necessary to give one education point, or you can say one tips for them. Whenever they will remove that preparation or insulin preparation directly from the refrigerator, they should wait, or they should keep out of that refrigerator that insulin preparation, and they should keep it for 5 to 10 minutes. Because if you are giving directly cold insulin, there will be stinging sensation in the site of the injection site. So we should take out of the refrigerator, wait for 5 to 10 minutes, so that insulin will get some normal room temperature, then we should administer, so that it will avoid stinging sensation at the site of injection. So while if patient is in hospital setup, so we want to discharge the patient, that time all these details what we have described, that also you can say to the patient. And apart from these things, you can demonstrate the dose measurement, how they can measure the dose. Because as we said before, in the case scenario, there, instead of insulin graded syringe, they have used tuberculin, which will be graded in the ml rather than units. So that will cause again some side effect or medication error. So next is, we should also say them to how to monitor blood glucose values. Nowadays already some glucometers are there, which they can use easily to monitor their blood glucose level after getting those insulin injections or during the insulin therapy. So next is, as we said before, hyper and hypoglycemia. So hypoglycemia symptoms, we can say them. What are the symptoms of hypoglycemia? Like we said before, extremities will be cold, patient will be unresponsiveness, and in further scenario the patient may also suffer from coma. So those effect of the hypoglycemia or some effect of the hyperglycemia you should say to the patient in order to identify early the hypoglycemia cases or hyperglycemia cases. So next is common types of error will be possible as always with their insulin therapy, and how to prevent or detect those kind of error, that also we should discuss with the patient. So these all instructions should be given if the patient is discharging in the hospital setup. So here why we describe these all details, because these all details you can say or you can give these informations with the needy ones which they are taking around you or around your in your home itself. If some patients are there means there also you can inform to those patients as well as your neighbors, so that the all patients will be getting benefit and we can use this insulin as safe and effective. So I have completed my presentation. If you people are having any doubt on this, you can ask questions. So now the session is open for questions.
Participants, if you have any doubts regarding that insulin, you can ask to sir. They will clarify your doubts. So I hope if any doubts are there, you can ask. If no doubts, then at the outset, starting with the insulin, starting with the disease, that is diabetes mellitus in that various types, type 1, type 2, then formulations of the insulins, different formulations of the insulin. Sir has told that while in insulin cartridge both are available, and meanwhile how the insulins have been classified on depend on mechanism of action or duration of action, long acting, short acting, rapid acting, intermediate acting. Then at the end, how to use the insulin and all. I would like to add some more points regarding the insulin, where to store and how to store. There is no mandatory to have the fridge to store the insulin. Even though if there is no fridge also, you can store insulin. You can maintain the storage condition. You can take a small utensil or a bowl, in that keep water, and you can put the insulin in a plastic cover and you can keep that into a bowl which containing a water. That is also storage condition, that will fulfill the storage condition. And regarding syringe and all, I think you might be knowing that if you are using the same syringe for more than 1 week, that sharpness of the syringe will be not there. Then it will creates so much of pain. Hence, usually that recommend if same person is using the insulin syringe for take the insulin, it may be discarded after 1 week. So like that, the precautionary measures should be taken. And meanwhile, changing of the site to do the injection, that also been changed periodically, whatever as sir has mentioned that clockwise. So with this, I would like to say special thanks to my colleague Ramesh Bhandari for explaining regarding this effective and safe use of insulin preparations. At the outset, I would like to say a special thanks to our principal sir for providing me an opportunity to organize such a webinar. And a special thanks to Vice Principal for attending the webinar. And thank you very much for you all. In spite of your busy schedules, also you are attending. And immediately after completion of this webinar, we'll be sending a feedback link. I request everyone to fill the feedback link to get the e-certificate. Thank you, one and all.
Thank you, sir.
Thank you, sir.